back to a new episode of the MemoMap. Today we are going to summarizing the respiratory changes during the exercise. First, we are starting with the general foundation and the question how is the gas is transported, and we are going to talk about the oxygen transport and carbon dioxide. Starting with the oxygen transport, we have two forms, the physical and the chemical form. Let's compare between both of them. The physical form represents a small amount. It's only 3% of the oxygen transport physically, and it's dissolved in the plasma. And it's important because it determines the oxygen tension, and this thus it determines the diffusion gradient and the direction of the diffusion. Since the oxygen move from the high oxygen tension to the low oxygen tension, what about the oxygen tension value? The important value in the lung is the oxygen tension around 95%, 90.35 millimeter mercury. In the venous blood is around 40 millimeter mercury, and during exercise it dropped up to 20 millimeter mercury. Moving to the chemical form, it is the large part of the oxygen. It represents 98% of the oxygen transported in the blood, and it bound to the hemoglobin. It's important because it is a major transport and reservoir for oxygen, allow large amount of oxygen to be carried to the tissue. And the value for the oxygen carried in the hemoglobin we are going to discuss in detail later on. But remember that we are going now to discuss the three main important definitions and value for oxygen, which but before this, let's say that we have in the blood two forms. One of form of oxygen dissolved, others is binding to the hemoglobin. But remember that the maximum amount of one hemoglobin of the oxygen can carried by the one hemoglobin is 4. So when we found hemoglobin carry 4 oxygen, we say it is full saturated. But if it lets, for example, if it carry 2, we say that it is 50% saturated. So from this point, let's move to the content and the capacity and the saturations. Okay, so what is the content? The content is the volume of the oxygen carried by 100 of the blood. In 100 milliliter of blood, we estimate or measure the amount of the oxygen that's carried by the hemoglobin. And remember here that the oxygen is not the hemoglobin is not full saturated, while in the capacity it is the maximum amount of oxygen in the blood carried when the hemoglobin is fully saturated. Remember that the capacity differ from the previous definition in two main words. The word maximum amount of oxygen, and the second word is the hemoglobin full saturated. That's to say, in 100 milliliter, all the hemoglobin are carrying the 4 oxygen molecule. And the saturation is the percentage of available hemoglobin binding site. So it is the content over the capacity multiply 100. That's to say the content, how much oxygen am I actually carry, over the capacity, which how much oxygen could I carry at the max. That's the saturation. So for easy remember, imagine if we have 100 milliliters of the blood. If the hemoglobin in this 100 milliliters carry different amount of oxygen, one hemoglobin is carry 2, 1, 1, 1, 3, 1, 4. So this is a content. But when all the hemoglobin in 100 carry the full capacity or the full amount of oxygen, the 4 molecule of oxygen, this is the capacity. So before we end this, remember that for the oxygen content, there are main three factors affecting it. First, the hemoglobin, the concentration of the amount and the affinity of the hemoglobin. Second is the oxygen tensions, and third, the metabolic status of the tissues. And now let's move to the final point here as about the oxygen hemoglobin dissociation curve. And this curve shows the relationship between the oxygen tension and the hemoglobin saturation. It is sigmoidal, it's S-shaped, so it is formed of two parts. First, the plateau part, and here the tension change from 95 to 60, while the saturation changed from 97% to 90%. Please remember the number, it's very important. So, while the tension fall a lot, but the saturation change small. That's to say the affinity here of hemoglobin is high and the hemoglobin is unloading. This part commonly seen in the lung, since the hemoglobin in the lung is has high affinity, so it is loading. The second part is the steeping part, and here the tension range from 40 to 60, while the saturation change from 90 to 70. In the steep part, the hemoglobin affinity is low, so the hemoglobin unload or give the oxygen to the tissue, and during exercise, what will happen? The tension fall more from 30 to 20, and the saturation also fall more from the 70 to the 20. So the saturation fall around 50%. This to say the affinity of the hemoglobin decrease more and more. Um, this curves may shift to the right. When it shifts to the right, this means that the affinity is decreasing, and this means the unload of oxygen increase, and this occur when the tissue metabolism is increased, so the carbon dioxide, hydrogen temperature, and 2,3-diphosphoglycerate is increased. And the curve shift to the left. This means that the affinity of hemoglobin is increased and the unloading or giving of oxygen to the tissues decreased, and this occurs when the metabolism of the tissues is decreased, so all temperatures, hydrogen, carbon dioxide, and 2,3-diphosphoglycerate are very low. Now, after we finish this, let's move to the carbon dioxide transport. And here we have also two forms. First, the physical form and the chemical form. The physical form is also dissolved. It represents the smallest amount, around 7%. It is also determining the carbon dioxide tension and the diffusion direction. In the tissue, it's around 40 millimeter mercury. What about the chemical form? It is the major form. It represents around 93, and it represents the carbon dioxide which combined with the hemoglobin, and its importance since it determines the transport of the carbon dioxide from the tissue to the lung. There are two types of the chemical. We have the carbamino and the bicarb. Regarding the carbamino, it's the carbon dioxide binding to the hemoglobin, while the bicarb, which is the main form, it represents the carbon dioxide binding to the water, forming the carbonic, which is associated to the hydrogen and bicarb. Remember that the bicarb occur in the plasma and the RBCs. However, in the RBCs, it's much faster due to the presence of the carbonic anhydrase enzymes. Move to the second major point in MemoMap, respiratory change during exercise, and we have two main points. What happened to oxygen consumption and carbon dioxide production during exercise, and how does our body increase the oxygen supply to the muscle, starting with oxygen consumption, carbon dioxide production. Due to increasing the metabolism, the oxygen consumption and carbon dioxide increasing to 20 fold, and to meet this we need to increase the oxygen supply. So how though we increase the oxygen supply to the muscles. And to do this, we have four main mechanisms. First, to increase the ventilation, which mean more air enter to the lungs. Second, to increase the oxygen diffusion, that's to say, moving of more oxygen from the alveoli to the blood. Third, to increase the cardiac output and blood flow. Now the oxygen is in blood but still need to be transported, so increasing the cardiac output and flow will deliver more oxygen to the tissue. Last, increase the oxygen unloading. Finally, the oxygen arrives to the muscle, so the hemoglobin needs to let go of the oxygen, and this is through decreasing the hemoglobin affinity. So, focusing about the ventilation, how does our body increase the ventilation? And for this, we have to remember the 3 btvn, which affecting the respiratory center, which is located or present in the brain stem. What are the 3 btvn? These are the blood gases, the proprioceptives, the brain, the temperatures, the venous return, and the norepinephrine. Starting with the blood gases, remember when with the sustained severe exercise, the carbon dioxide, hydrogen, and the pH decrease with the lactic acid increase, and this activates the respiratory center. For the proprioceptives, the receptors present in the muscle joint with movement. Those muscles activate to activate the respiratory center. The last B, the brain, the motor cortex. During exercise, at the beginning of exercise, the motor cortex send a motor impulse to muscle to contract and collateral impulse to respiratory center to be activated, and this is called a condition reflex. Moving to the temperatures, with exercise and increase the metabolism, the production of heat increased and body temperature increased, so the hypothalamus is activated and activate the anti-rise and sending an impulses to respiratory center to be activated. The venous return during exercise, also the venous return increases, activate a mechanoreceptor in the right atrium, causing activation of the respiratory center. Last is the sympathetic activation during exercise, increasing the norepinephrine, which directly activates the respiratory center. So the respiratory center in the brainstem is actually activated by the 3B, the blood gases, the proprioceptives, the brain, and the TV, and the temperatures, the venous returns, and the norepinephrine. And now we reached to the end of today MemoMap. Today we talked about the respiratory change during the exercise. First, we're starting with the gas transporting and the oxygen transport, which is divided to physical and chemical. The physical, small amount dissolved in blood determines the oxygen tension and the direction of diffusion. The chemical is the major amount binding to the hemoglobin, carrying the most of oxygen to the tissues. And remember, one hemoglobin molecule bind up to 4 molecule of oxygen. When there is 4 oxygen molecule, it's 100% saturation. When it's less, the saturation of the hemoglobin decrease. Then we also talked about three important terms: the content, which is the actual total amount of oxygen carried by 100 milliliter of the blood. The capacity is the maximum amount of oxygen that 100 of blood carry when the hemoglobin is full saturated, and the saturation is content of the capacity multiplied by 100. Remember that the content is the small, it's the actual amount, and the capacity is the maximum. When all hemoglobin is full saturated, all hemoglobin carry for oxygen, the saturation is the percent of the actual over the maximum. Then we talked about the oxygen dissociation curve. We said the relationship between the tension and saturation is S-shaped sigmoidal with two main parts: the plateau with high affinity of oxygen and loading in the lung and the C part with great unloading and low oxygen affinity as it occur in the tissue. And during the exercise, the saturation and the tension decrease further. And then we talked that the curve shift to the right during exercise due to increase the metabolism, such as the carbon dioxide, hydrogen, temperature, 2,3 diphosphoglycerate. So this will decrease the affinity, making the unloading of oxygen easy. The right shift when occur when the so this is right shift. So right equal release, right equal oxygen give the hemoglobin, sorry, give the oxygen to the tissue, while left mean that the affinity of hemoglobin to oxygen increased. The hemoglobin hold the oxygen, and this occur when the metabolism of the tissues decreased. So the carbon dioxide, hydrogen, temperature 2,3 diphosphoglycerate decrease. Then we move to carbon dioxide transport. Also we have physical and the chemical. The physical dissolved this amount determine the carbon dioxide tension, while the chemical is a major part. It's major form for carbon dioxide transport, present in two form, the bicarb and the carbamino. Then we move to respiratory change during the exercise. We answer two main questions. What happened when we exercise? The muscle metabolism increase, so the consumption and production of consumption of oxygen increased, the production of carbon dioxide also increased, and to meet this, we need to increase the oxygen supply by increasing the ventilation, increase the oxygen diffusion, the cardiac output, and the blood flow, and increase the oxygen unload. How do we increase the ventilation? By activation of the respiratory center in the brain stem, and to do this we have 3B, TVN, the blood gases, the proprioceptive, the brain, and the TV, the temperatures, the norepinephrine, and the venous return. Remember, the blood gases occur with a sustained severe exercise, increasing the lactic. For the proprioceptive movement of the muscle joint, for the brain, the conditioned reflexes with the collateral impulses sent to activate to the respiratory center. The temperatures is from the hypothalamus to the respiratory. When body temperature increase, with the venous return increase, the mechanoreceptors stimulate the respiratory center, and when sympathetic activated during exercise, the norepinephrine is responsible for activation of respiratory center. Well, that's the end for today. See you in the next episode.